We offer a BSc Nursing programme, which has two exit options, a Bachelor of Science in Adult Nursing or a Bachelor of Science in Mental Health Nursing. Along with your degree qualification, successful completion will also gain you professional registration with the Nursing and Midwifery Council.
This programme would suit anyone who is keen to pursue a career in caring for people and has an interest in the health and well-being of others. There are also interesting learning topics such as science, how the body works, what happens to the body and mind during illness, and what we as healthcare professionals can do to help. Nursing is a career which requires teamwork and excellent communication skills. So if you have an interest in people and enjoy working with others, then this could be the course for you. Our students come from a variety of backgrounds. Many are school leavers, but our programme also appeals to those looking for a career change which will utilise previous life experience and transferable skills.
The nursing course comprises of 50% theory and 50% via practice learning. During theory modules, we use a blended learning approach, including online lectures, self-directed learning, face-to-face seminars, small group work, clinical skills teaching, and simulated learning. We offer a great variety of learning experience, both in theory and practice. This breadth of experience enables our students to develop the clinical and critical thinking skills required for their future career in nursing.
As part of our programme, students are required to complete 2,300 hours of clinical practice, which is distributed over 8 practice learning experiences throughout the 3 years. One of the fantastic things about this programme is that we offer practice learning experiences throughout the Highlands and Islands and also NHS Grampian. These placements are in a huge variety of clinical specialities and beautiful geographic locations. Whilst on placement, students are supported and assessed by clinical and university staff.
In comparison to other programmes, our nursing cohorts are quite small, which means that we are really able to get to know our students and support them through their studies. Our course is student-centred and student-focused. Students were involved in the design of our current programme and contribute to the ongoing evaluation of our curriculum. We are also incredibly lucky that both of our campuses in Inverness and Stornoway are situated in beautiful parts of the world. Students can explore the mountains, beaches, forests and cities of the Highlands and Islands in their free time.
On completion of the programme, most of our students progress directly into nursing roles within the NHS. The entry-level nursing role is a Band 5, with opportunities for career progression through the bands. Whilst the NHS is the most popular employer for our graduates, many of our students also gain employment with third sector and local authority organisations. One of the excellent things about nursing is that your career can be varied and a stepping stone to many other opportunities. You can travel the world with a nursing degree, and you can engage with further education and take up advanced nursing roles. Nursing also allows you to develop transferable skills which are valuable in sectors such as politics and business. I'm really passionate about mental health nursing because it's so important for everyone to have or be enabled to have good mental health. Having good mental health is the foundation that allows people to live a fulfilling and satisfying life and to be able to cope with what life can throw at them. Being able to enable people living with mental illness to engage in their recovery journey is very rewarding.
Nursing is a profession that requires you to love both people and science. You learn biomedical science, anatomy physiology, pathophysiology and pharmacology. I always say that being a nurse is a privilege. You meet and care for people from all walks of life, often at their most difficult times in their lives. You walk alongside them and you share their story. Sometimes that story ends in recovery, sometimes it doesn't. But it's wonderful to have a job that allows you to make a meaningful difference to the lives of others.
I spend most of my time teaching, supporting and assessing students. As professional lead, I also guide and support colleagues to ensure the smooth delivery of the nursing programme. I also have a keen interest in quality improvement. Prior to becoming a mental health nurse academic, I worked clinically as a mental health nurse in areas such as adult mental health, including acute admissions, alcohol and drug detox, and most recently in child and adolescent mental health.
I am the undergraduate programme leader. I work with students and colleagues to ensure effective delivery of the programme. It's important to keep open dialogue with students and practice partners to maintain currency and quality. My own background in nursing is in emergency medicine, minor injuries and illnesses, with a specialist interest in dementia and delirium.
I enjoy building capacity and confidence in students so that they can deliver a high standard of evidence-based mental health care and they can engage those living with mental illness in their recovery journeys.
I'm continually inspired by our students and their enthusiasm for nursing. It's incredibly rewarding to share my experience and contribute to the development of skilled and compassionate nurses of the future.